Good afternoon. Thank you so much for joining us today. And we're having a discussion about wellness and mental health in the COVID era, strategies to mitigate risk and manage liabilities. This conversation today includes an outstanding panel. I'm really excited to introduce our panelists in just a moment. My name is Nicole Willier-Fenton. I am the Content Marketing Manager in UVM's Continuing and Distance Education. We are about to put on also the 30th anniversary of the Legal Issues Conference starting on October 19th, the 20th, and the 21st. So this is a little bit of a teaser and a advanced notice of some of the content that you will be able to see in the Legal Issues Conference and the caliber of presenters that are in our Legal Issues Conference. So we're very happy to have three of our presenters with us today. I'm going to allow them to introduce themselves in just a moment, but what we're going to talk about today is the challenges facing UVM. Several years ago, before the wellness environment at UVM was a actual environment, and it was probably a philosophy. It was a little bit more of a theory that Dr. Jim Hudziak had, and we'll learn how our former president, Tom Sullivan, who is joining us today, saw the vision to be able to bring that to fruition with this outstanding team. Why a wellness environment? Dr. Hudziak will walk us through what is that environment and why is it so important to the mental health and well-being of our students at UVM. And Annie Stevens will walk us through how it was implemented and the results of that here at the University of Vermont. We are looking forward to your questions. You can post those questions in the chat box. And we'll also just another reminder about the Legal Issues in Higher Education Conference, which is coming up in just under 2 weeks. So we're going to get started. I would like to introduce our panelists. We have our former president of UVM, Tom Sullivan, joining us as well. We have Dr. Jim Hudziak joining us and Annie Stevens as well. I'm going to ask each of them to do a brief introduction, and then we'll dive right into the content. So I'm going to toss it over to Tom first. Tom?
Thank you, Nicole. Welcome, everyone. As Nicole said, I'm President Emeritus of the University of Vermont. I stepped out of that position a year and a half ago, July of 2019, and I'm now a professor of law and political science full-time at the University of Vermont. Before that, in the order in which I came to the university, I was a provost and senior vice president at the University of Minnesota for 8 years, and previous to that, 7 years as dean of the law school at the University of Minnesota. Just before that, I was dean of the law school at the University of Arizona, and prior to that, associate dean of the law school at Washington University in St. Louis. I've been a former federal prosecutor in the Department of Justice in Washington, and also in private practice of law in a large Wall Street and Washington, D.C. Law firm. And right out of law school, I clerked for a federal judge. So that's my background coming to the University of Vermont.
Thank you, Tom. Jim, we'd love to hear from you as well.
Well, thank you so much. It's an honor to be able to present to you all, and also an honor to follow Emeritus President Tom Sullivan. Tom, I'm reminded of the eerie path that we've both taken. Kids from Central Illinois, time at the University of Minnesota, which is where I did my medical school, Washington University, where I did my internships, residencies, and research fellowships, and now landing here with Tom in the University of Vermont. Been here 29 years. I'm trained as a genetic neuroimager. I'm the chief of child psychiatry. And I'm going to tell you how all that came together in the UVM Wellness Environment.
Thank you so much, Jim. We really appreciate that. Annie, can you just share a little bit about your background and the position you are in here at UVM today?
Sure. Good afternoon, everyone. And I, too, am honored to be with Tom and Jim for this session. Annie Stevens, and I'm the Vice Provost for Student Affairs at the University of Vermont. I've been at the university now for almost 24 years, where I've served in leadership positions within student affairs. And I came here as the Director of Residential Life, and then different leadership positions within the division until now being Vice Provost. Before that, I was at the University of Maryland, College Park, getting my Ph.D., as well as before that was University of California, Berkeley, and North Carolina, Chapel Hill. So it's been a great career, and it's been wonderful to be here at the UVM for so long.
Thank you very much, Tom, Dr. Hudziak, and Annie. We're going to dive in. We've got a lot of content to cover today. And as I mentioned, welcome to our viewers on YouTube. We'll keep an eye on those questions and have some time for those Q&A at the end. This is being recorded, so we're happy to share the recording with you post the session today. We're going to start with Tom Sullivan, because it was really an understanding of what was happening, the challenges that he was facing and his administration was facing at UVM at that time, and the perfect time for Dr. Hudziak and Annie Stevens to see what is the possibility for our students here at UVM. So I'm going to toss this over to Tom.
Thank you, Nicole. Well, shortly after I became president of the University of Vermont in June, July of 2012, through many conversations with Annie Stevens, it became very clear to me that on our campus, as well as almost all college and university campuses in the United States, there was a need and a problem, and it was growing with regard to student alcohol and drug abuse usage. So after many conversations with Annie and Jim, of course, we decided to go very public with the challenge here at UVM, and I think around the country at other colleges as well. And we decided that we wanted to name this problem, excessive alcohol use and misuse of drugs on campus, and how it was affecting our students. Turns out that naming it publicly, explicitly, was and is very important to let everyone know that we all together as a community, as a university, have these challenges. And so shortly thereafter, I established a university-wide commission on alcohol and drug use on campus. And we had faculty, staff, students, parents, alumni, a broad array of community leadership on that commission so that we could really hear from everyone involved or who had knowledge of these challenges. Right at about the time we were developing the concept around the commission and its work that we would be seeking, we began to hear from our experts, Jim and his colleagues at our wonderful medical school and our hospital here, of new challenges, mental health challenges. We were beginning to see a spike in increase of the number of our students going to our student health center right here on campus with mental health challenges. This became very obvious very quickly. And so we began to fold those issues together, alcohol, misuse of drugs, and a whole array of mental health challenges for our students. And at the same time, Jim and his colleagues were bringing us new research with regard to brain development. And for some of us, it came a bit of a surprise, perhaps it should not have, but that the brain in a young person, male and female, really doesn't develop until age 25 or 30. Well, perhaps that started to explain a few things, but for us, it was a wake-up call, quite frankly, and that we were educating a group of students here and elsewhere in an age group where their brains were not fully developed, and that might explain some behavior. But again, that became part of naming it, and it helped inform our understanding of how to proceed on campus with our plans. Right at about that time, I was beginning, quite independent, we thought, thinking about the need for a new residence hall on campus. And one of the very first things we decided was we wanted to put this new residence hall right in the middle center part of the campus for a variety of reasons, for architectural design reasons, for continuity of academic programs, ease of residence halls to cultural and social and academic venues on campus. But it dawned on Annie and Jim and myself at the time, why not use the new residence hall, which was going to have a spectacular new design, be the centerpiece for this wellness challenge that we were taking on. And so it became, on the one hand, building a facility that would also be part of the great challenge while we were culturally, socially, and intellectually coming up with the strategies. And Jim, of course, will talk about, and Annie, the strategies for a healthy mind and body development in just a minute. But as I conclude my remarks, I would just add, and Jim and Annie will share with you some of the real important student developmental and health outcomes that came about. But what we found at the end of our first year, quite frankly, and it continued thereafter to my knowledge, was that there were real comparative advantages for UVM taking the lead out there, talking about the wellness and the importance of wellness for our students, that we had inadvertently, this was never part of the original vision nor our early strategy, that we had a real advantage of a university in recruiting students, and particularly the energy and enthusiasm of their parents in coming to UVM because of the reputation that Annie and Jim and their colleagues developed by creating this very holistic mind and body positive development for our students. And so all of a sudden, without strategic planning, we have a comparative advantage. Our reputation is enhanced in the admissions scene, and quite frankly, it becomes a very important, critical, pervasive part of our brand. And I hope that's still true today. Thank you.
Thank you, Tom. What changes have happened on this campus over the past several years, and such positive changes for students? We're going to now turn to Dr. Hudziak. So the problem was named, the commission was set up, you step in and provide some amazing information and passion and perseverance, I must say, from what I've heard, to get this going. Jim, will you walk us through the next steps before we turn to Annie?
Absolutely. And after hearing Tom speak, you could see there was a bit of a perfect storm to blend the ideas that were coming out of 30 years of our research with the vision that this university had. But I run the child psychiatry division, but I've been doing massive studies around the globe on trying to promote brain health. We at the University of Vermont came up with an approach that argues that health promotion outperforms prevention and intervention. And that's worked wonderfully in a clinic. And we decided to try to put it in the college environment. Now, setting the stage, it's important for everyone to know that it's a new world out there. And Generation Z, which marks our current college freshmen and forward, we recently did a survey, and 97% of them, I did this survey on TikTok, by the way, to demonstrate how hip I am. 97% of them reported incapacitating stress, anxiety, and depression, and a lack of any idea on how to deal with it. And if you start to think about this in terms of brain development and stress, these kids were born with a phone in their hand. They have lived their entire life in a new domain, a digital domain that's often very judgmental, not very kind, not very gracious. It's just a population of young people who come to campus ill, who come to campus with severe emotional behavioral problems, and who have turned to substance use and abuse as a way to calm this suffering. They're wildly associated with academic failures and struggle. Code on top of that, COVID, and the isolation for those who are externalizing and the fears for those who are internalizing all creates a perfect storm. Blend into that now this national journey that we're all taking to make sure that whatever we do is socially just. And you've got a perfect set of problems that we all need to address, and we are trying to at UVM. Next slide, please. So this whole thing that Tom was talking about is the brain. We've done neuroimaging studies on 10,000 babies since birth in the Netherlands, 14,000 kids through imaging with Hugh Garavan and others, and showed that the most important part of the human brain, next slide please, is called this cognitive network, represented here with this blue slide that shows you connecting the prefrontal, orbital frontal, ventral medial frontal cortex to the working areas of the brain. This is a very very modern part of the brain, and it's in a constant war with this red area of the brain called the emotion network, fight or flight. You've all heard of the amygdala, the hippocampus. This is a very, very ancient part of the brain, and fully developed by age 14. Fight or flight, procreation, pleasure. Next slide. These two areas of the brain battle with each other. Next slide. And they battle with each other for regulation. And the best thing we can do in universities is to develop well-developed blue brains, task-positive networks, attention, concentration, mood regulation, availability to the presence. Next slide. But one of our major problems is all of the proponents that have come prior to us to develop a part of the brain is devoted dearly to the red part of the brain. Here, a joke with John Belushi. This amygdala, drug, alcohol, I hate myself, fight or flight. This ancient part of the brain is rewarded in a university environment where people are not protected and not rewarded to develop this task positive region of the brain. Next slide. So we have to think about how we build these areas of the brain that not only help you regulate your emotions, but pay attention, concentrate, and succeed academically. Next slide. How do we take our students into this period of self-regulation so they can be present in the moment, learn and pay attention, and diminish the fears that go with the uncertainty of this dysregulated area of the brain? Now, this is wildly important today. Next slide. Because stress diminishes activity in this blue area of the brain, actually diminishes cortical thickness in this area of the brain, diminishes the functional integrity of this blue area of the brain. That makes the red area of the brain bigger. Makes me want to search out alcohol, search out drugs, search out pleasure, procrastinate, not like myself. The human brain pan has not changed in 10,000 years, but culture has dramatically. And it's time for us to make an investment in university settings to developing the part of the brain that helps young people reach the arc of their potential while they become good students. Next slide. So when this all came out, what was the response of a physician scientist and his, her, and their group? Next. Is just to say, how can I help? Because if I see a patient and family, 8 of them a day, I'm doing good. Back up, please, 2 slides. I'm doing fairly well for those 8 patients. But what if I could suddenly help thousands? And the point of this discussion, thousands and thousands. Next slide. So what we came up with was a neuroscience-inspired, a neuroscience-inspired behavior change program to build healthy brains. Comes from the work of our lab, Steve Higgins' labs, where we can actually help people move towards things that are good for their brain. Next slide. We call this bringing gorgeous science to student life. The decade of the brain has passed into the millennium of the mind, and it's the responsibility of universities to put health promotion neuroscience into students' lives. Next slide. We've published all this, so if you go to PubMed or the internet, you can find all the models that we brought forward. Next slide. But you can really simply understand what incentivized-based behavioral change is all about. Next slide. By thinking of all of those New Year's resolutions you made and rarely kept. And one of the reasons we rarely keep our New Year's resolutions is no one's paying us to keep them. Incentivized-based behavioral change is to help people modify their behavior in a way that they desire by rewarding them, incentivizing them to do so. Next slide. And having a contingency that is enforceable. If you violate a certain set of rules, you'll be removed. And you'll hear about that in the we environment. Next slide. So we take this incentivized approach and we applied it to a transitional age brain, which Tom mentioned. Next slide. Again, published, and you're welcome to go grab this online. Next slide. But what we can see here in this graphic is from age 4 to 22 that the brain is going through rapid architectural rearrangement with the goal of organizing your brain when you're an adult. Next slide. Click on this slide, please. At the bottom of the slide, there's a little bar that you can click on and make a video run. Yeah, right there. Thank you. The bottom is the back of the brain. The top is the front of the brain. And what you'll notice here, and I'm going to ask you to play it one more time, and I'll call out the years, 8, 10, 12, 14, 16. Notice the entire front of the brain has not been organized yet. That is the area of the brain you need to succeed in college. As Tom mentioned, brains are nowhere ready to do the work they need to do when they arrive at universities. Next slide. We call it pruning a tree. Wax on, wax off. The behaviors you engage in will determine what your brain looks like. Next slide. And we've learned that this profound brain maturation, next slide, is induced by the environment you come up in. The brain matures from the front to the back. And we need to invest energy into the maturation, from the back to the front. We have to invest energy in the maturation of that frontal region of the brain. Next slide. All of you have seen a house being built. 6 months before it's completed, it looks horrific. Half the roof is on, electric wires incomplete. And 6 months later, you see a beautiful home. That's the best way to think of a college freshman's brain. Next slide. So what did we do next? We created curriculums that basically show what you do impacts your genome, the structure of your brain, and your thoughts, behaviors, and feelings. Next. This curriculum is taught in a class, Healthy Brains, Healthy Bodies, that brings to young people's lives all the things they can do to build their brains. Next slide. It's built around this simple argument that's been shown over and over in the literature and again in our lab. What you do impacts your brain and your behavior. Next slide. We've shown this for exercise, but we have world's experts like Art Kramer, next slide, who come up and show daily exercise builds your hippocampus, the key region of the brain for academic success. Next slide. John Kabat-Zinn, our dear friend, shows mindfulness, yoga, and breathing improves cortical connectivity in the OFC areas of the brain for regulation. Next slide. Next slide. John Cryan, teaching today in our program from Cork, Ireland, shows what you eat impacts the structural integrity of your frontal cortex. Next slide. Kempton shows us the amount of water you take in a day improves your emotional regulation. Next slide. Matt Waller shows the amount of time you sleep improves cortical connectivity from your hippocampus to your prefrontal cortex. Next slide. Nina Kraus, next slide. Nina Kraus and myself have shown, next slide please, have shown just practicing and playing music improves cortical connectivity in this key frontal area of the brain. Next slide. Sue Smalley showing the dramatic effects on cortical connectivity between the reward areas of the brain in the practice of kindness and gratitude. Next slide. Next slide. And Alan Budney and others showing us the profound negative impact that cannabis, next slide. And McKay showing us that alcohol has on these same key areas of the brain. Next slide, please. Adam Gasley, our college at UCSF, showing this digital world causing connectivity problems for the human, particularly young people in emotional regulatory areas. Next slide. Taken together, we create a curriculum that shows young people, here's the things that help you build your brain, here's the things that might not be so good for your brain, you're the only one who can build your brain. Next. We take it into these residence halls. Tom described the central campus residence halls, which made this job dramatically easier after a couple of years in less desirable buildings where we had the same kind of success. Next slide. We built around 4 pillars in the buildings using an incentivized-based approach to literally pay our students to engage in mindfulness, fitness, positive relations, and nutrition. Next slide. With world's expert coming in, helping us build in-hall meditation, yoga, mindfulness training. Next slide. Fitness, earning free fitness passes, in-house Peloton bikes, Apple Watches to incentivize your exercise. Next slide. Incentivizing people to mentor young students, to mentor youth in our community, incentivizing people to be kind and gracious to each other and actually use and earn certificate programs for positive relationships. Next slide. And talking about positive neuronutritive and hydration approaches, all with rewards, which you'll see in a second. Next slide. We then took it to a digital level, remembering that these kids have grown in a digital environment. Next slide. My team and I developed an app called Healthy Brains, Healthy Bodies, which takes all of those things I just showed you and gives them something called We Coins. Next slide. So we'll give you We Coins for your exercise, your mindfulness, your yoga, your breathing. We actually give our students We Coins if they're kind to each other, if they're gracious to each other. Next slide. These are pictures of the app showing how the students earn their coins in these areas like mindfulness and meditation. Next slide. We offer through an AI, machine-based learning coach, insights. We notice you didn't sleep so much. Try this. We notice you haven't been being kind. Try this. Then we measure whether or not they do it. Next slide. Every time they do something good, we give them We coins that go into their We bank. Next slide. They go from the We bank to the We store and they buy We-centric gitch, they call it, that trumpets the idea of being well. Next slide. And trophies. Who doesn't like trophies? Next slide. On the app, which has become wildly important since COVID hit, we have yoga and mindfulness and continue to reward our students who were home during the second semester of last year by going online and doing our yoga, our mindfulness. Next slide. Accessing the same yoginis and health promotion coaches they knew in person. Next slide. Next slide, please. Doing the 9-minute workout, they can actually do yoga and mindfulness right off our app in their parents' home, in their own home, in their room. Next slide. Over 186 meditations developed just for college students. Next slide. All with the goal to improve their health and well-being. 4 minutes left. We collect data on them every night, 20 questions on their emotional well-being. They get We coins for that as well. Some fun data. Next slide. Across an academic year, this shows the daily mood status from the first week of school till the end of the year. And you can see there's some peaks. You automatically want to know when are your students happiest. Next slide. And sadly, you'll see it's when they go home on Thanksgiving break, winter break, and spring break. Next slide. Here you see their daily mood status on weekly averages. Next slide. And we correlate it with exercise. And again, they're happiest when they exercise, but when they go home for Thanksgiving and spring break, they quit exercising. Next slide. And they sleep more. Next slide. And they drink more. Next slide. Leading us in our program to send our parents these fun notes about, hey, when your kid's at home, don't let him or them sleep 15 hours, exercise less, or drink more. For your own schools, you can learn about everybody on campus. Next slide. Here's just happiness during the week, and they're happier on Friday and Saturday. I wonder why. Next slide. The same days of the week they stop exercising. Next slide. And the same days of the week they sleep more. Next slide. And drink more. So we've actually rewarded people for 7 days a week of exercise, 7 days of sleep. This paper was just accepted in press. Last year, as all of you know, half the year we were on campus. The virus hit, they went home. They were filling out these things every night on campus and at home. Next slide. And what you'll see in this first frame is the optimism that students had with the fact that the government was going to help us manage this well and get us back. 78% of students have complied with what the government asked them to do. Mapping on some of our early COVID success this year, students want to do well if they know what they should do. Sadly, this shows the degree of disruption in their lives that students report. Next slide. And here what we see, the beginning of the year to when COVID hit to the end of the year, this is where their moods were. This is where their wellness index was. This is where stress is. COVID hits, their moods fall, their wellness indices fall, and their stress goes up. Actually, an advertisement for why we need them on campus and why it's probably important for us to contrive to take these underdeveloped minds, put them in a place, and help curate things that could help them. Next slide. This is a remarkable piece of this paper that the the college students in the wellness environment, when COVID hit, their internalizing problems went down. They knew how to deal with it. When COVID hit, their attention problems got worse, but the control group was higher, and their externalizing problems got worse. The college as usual group was higher, allowing you to start to now compare and contrast how different environments impact students on campus. Next slide. So wrapping up, next slide. Nicole, just fly through these. As Tom mentioned, and we published all of this as well, we were surprised. Next slide. Boston Globe, NBC News, continue please. CBS Morning Report, CBS Evening News, next slide. Our own local papers talking about drug violations being half, next slide. NCAA Magazine talking about the impact on athletes, next slide. Community programs such as our 4K for Wellness being over-attended, next slide. Next slide, please. I'm running out of time and I apologize. Just click through. The conclusions are pretty simple. For college students, all health comes from emotional behavioral health. Modern neuroscience is providing us with a way to think about building healthy brains, and no developmental period has been ignored as much as the college-age brain. These strategies make good sense from a scientific, programmatic, and financial point of view. The neuroscience behind these arguments is sound, and we present to you one example in its 6-week year that's working quite well. I'd like to end there, and thank you.
Thank you so much, Jim. So much information to try to process and comprehend. I can only imagine what it was like in the middle of trying to lift this up. And so Annie Stevens steps in and says, this is a great idea. How do we do this? So Annie, we're going to toss it over to you. How do you take from, it's one thing that there was a building in process, but how do you take from the vision, the data, to the implementation?
Thank you very much. And I don't want to underestimate at all what it took for these two leaders to help do this, you know, with Tom Sullivan's basically vision and leadership. It's not easy to name an alcohol problem on a college campus. And then you merge that with science, which often can be siloed, and especially on a college campus, we can get into our silos. And then to come together and be open to what could we do together to make sure that this is an outstanding student experience, not only just for the students who participate in the wellness environment, but how might it impact the rest of our campus, and who are we, and changing our reputation and our national known reputation across the country and around the world, really. So my few slides are just about the history and the growth, about the environment that we really aspired to create, and a little hint toward the outcomes that we were looking at to know if we were successful or not. So I'll just move through these quickly and then leave time for questions and answers, but you can go to the next slide. So a little bit about the we history, and the next slide shows this in a chart form. So President Sullivan mentioned the commission that he began, and that brought together 73 different individuals, alumni, parents, neighbors of the university community, and we kicked that off and had some real clear goals about reducing high-risk drinking on a college campus, knowing how it was impacting the student experience detrimentally, not to those only who were high-risk drinking themselves, but how it was overflowing, if you will, for a bad phrase, perhaps, onto the rest of the students and the student experience. And then the connection with Jim, between student affairs and Jim and his idea was made about 2014. We started to talk about, so what could this be like? What does this mean? And at that point, we had a residence hall, and many college campuses have this today, so no disrespect, but a residence hall of about 30 that had, it was more like theme housing, where it was, you know, you could live here if you did not want to drink. Of course, or all of our residence halls are that way, but there was one where students really were more followed abstinence around this. So Jim's idea of connecting science and incentives, actually, around the incentive behavior change model was really what got us hooked. And so we launched the wellness environment in a smaller time, and that was about 150 students. We're like, okay, Jim, although, you know, it's hard to keep him in place with good ideas, let's start small, and small to us, you know, and to Jim was 150. I think I could have started with 30, but Jim wanted 150. I'm like, all right, let's see who shows up to this residence hall environment. And then we grew it to actually, in 2016, we grew it to about 400 in a place that not necessarily all the students really liked on campus, and it was furthest distance, not the best of our residence halls by any means, but it had overwhelming results when we moved the wellness environment over to a more distant part of campus. And that is because of the community that was built around the programs, around the course that the students took together, and around the initiatives and the incentives that were provided in that community. And then, as Tom also talked about, then we had the opportunity to really strengthen this whole program by moving it to a brand new residence hall in the center of campus, all first-year students, about 800 first-year students. So a really huge chunk of who really comes to UVM and how can we give them the best start possible. I'm going to stop right there and note that after a couple of years, and Jim and I have often talked about this, after a couple of years, we kept saying, well, are they really showing up? I mean, just in droves showing up to be a part of the program, and are they showing up because the residence hall is new or because of the program, and what does that really mean? Well, after a couple of years of looking at that, we understood that it was like a little under 50%. We're really there for the residence hall. They wanted it to be nice and the amenities they got, and it was right in the center of campus, and yet the outcomes were the same. So you could go into a residence hall, but what was happening once you were there was changing your behavior. So that, to me, and any of the data that we can show you, shows how powerful this connection to neuroscience, to behavior change incentives really can be for these young adults. And then really we launched a broader learning community model across our campus, not to the extent that the wellness environment provides by any means, but offers some themed and classroom experience for our students, especially first-year students. And now there's a full implementation of that learning community initiative with, of course, the wellness environment being a signature program for the campus, among a few others. So that just gives you the timeline of how we unfolded this program and what it has looked like over the last few years with all of us involved. Next slide. So as many of you out there may wonder, like, what did it take? Like, how do you do this? And this is just a snapshot of the expenses, the funding sources, and what it did take. And Jim's wonderful ideas around really lifting up the campus, not just the participants in the program, creating something that goes, to all of the campus in terms of a 425K. Jim is an amazing philanthropist himself, and he knows what can guide and inspire others to donate. And so we were benefited in a great deal, and still are, by many benefactors to the program. He created a We Speak Here series across the campus, and pillar programming, as he discussed. And then outreach and recruitment efforts. He was always there. He will always show up. This is the stuff that's above and beyond that when you talk about other themed housing on a college campus, that Jim and his staff really are always there. They are always willing to pitch in, and that is key when you think about blending a student affairs, student experience, what we have, toward folks who walk in and want to offer the science and the curriculum to that, and knowing sometimes they're not always there with you, and Jim and his team were always there and always present. And then the funding sources, well, the research he talked about, and the staffing and the salaries all had to be worked out. Let me not minimize any of that. It was huge. It's still big discussions about how best to resource it. What does it mean to resource this? But it was a combination of residential life staffing and programming money. We venture program fees. That was an early arrival program that Jim wanted to do. He knew that catching students, especially first-time first years, before they even started classes, and introducing them to the program was going to be key. He had a $1.8 million grant over 3 years, and then, of course, some funding. We call it IBB, but it's incentive-based funding from the class, and then, of course, private donations. So it took a lot. There was a lot of intense moments and build up and preparedness to really launch this program. And also it was over a period of time. Next slide. The staffing structure for WE is a program delivery model, right, that Jim talked about. the pillars, who's there, the faculty director, Jim being in and around. He comes and has breakfast with students every Friday, pre-COVID. You know, an associate director that actually we had in our Center for Health and Wellbeing, and moved him over to work with Jim more closely, to blend those parts of the campus together between our Center for Health and Wellbeing and this wellness program. And then, of course, now 4 program activity coordinators. And what does that really look like? And what does it mean for RAs, right? And the residence hall staff, and how does all that work? And it is building a community of leaders within that residence hall that are all on the same page. We had bumpy years. There were years where it felt really hard. And still sometimes we have to be incredibly clear with both staff, with the wellness environment staff and the residential staff, that we are a team and we're one team and we've got to work together. And then Jim talked about the 4 sections of the course and the research, and we also have someone who looks at all of the digital, the business, their outreach programs that they're able to offer. Next slide. And these next few are really more about the program itself. So I'm just going to fly through these here because Jim did a great job, better than I can, about what it really took. But as a signature program, you can see kind of the outline of the faculty engagement, the academic course, students engaged in activities, research funded. Like, this is the stuff that, for my student affairs colleagues out there, that goes above and beyond theme program and theme housing that we often talk about. He talked about the transitional brain age, which I do think is critical in this, to have the knowledge and to give that knowledge back to students and give them agency about what's happening to their own bodies and mental health and physical health, I think was key to this program. The wellness activities being incentivized shifted the behavior, shifted what they knew was breaking, really, at that point, college norms. You know, he showed John Belushi in one of his slides. You know, we have these fictitious norms about what college is supposed to be. And so really this program is helping us shift that. At this day and age, like, students don't have to show up to a college atmosphere or a college experience that is centered around drugs or alcohol. And that was really my main mission. And Jim came at it from such an amazing place of give them incentivized reasons to stay healthy. And then certainly he talked about this, but the strategies include a healthy brain. And making sure the academic piece was just as important, if not the most important piece of the wellness environment. Next slide. So here you can see the growth from what I discussed already, but how quickly it took off. I've never seen a program, I've worked in student affairs over 30 years. I have not seen a residential program take off this quickly with this much attention. Much of that had to do with President Sullivan. Much of it had to do with Jim Hudziak, and a lot had to do with the fact that we kept it going, and we knew that parents, families, the students themselves were actually just begging in some ways to find a college campus who stood out and who was different in offering what it meant to have an outstanding student experience that didn't center around drugs and alcohol. So here's the growth over time. And then next slide. The demographics, this is a little early on. I think they probably stay about the same, but Jim can correct me if I'm wrong. But the demographics play out where in the early years we attracted a few more females, slightly more Vermonters, which was interesting in state since we're an institution that is mostly out-of-state students, and more nursing and health science. So that didn't surprise us, right? That we have an outstanding health sciences program at the University of Vermont. And so we attracted some of those students. But as I said earlier, it definitely attracted others for different reasons, and those outcomes were just as good. And yes, we attracted students of color. The diversity in the program was the same, if not better, than the diversity on our college campus. Next slide. And then the environment, which is really where Jim shared his slides. So I'm going to go through these quickly as well. Go ahead. So that's the foundation, is the Healthy Brains, Healthy Bodies course. Next slide. Here's really this diagram shows you the interconnections between the behavior change, the residential experience of those 4 pillars and how are we programming around those, like the dining hall experience that Jim talked about, and getting our dining services in line and on board with a program and offering healthy nutrition, teaching dining, how to cook basically in that dining hall. I mean, we changed everything that we know about the same old kind of how you offer a student experience to how do we weave this science and this incentivized behavioral change into everything that we do in that student experience. And then the third, of course, is the research and the measurable outcomes, which also isn't easy on many college campuses. And I think we're getting better now in student affairs, measuring our success and putting down a mark in the sand and saying, where are we headed and where do we want to be? And that was a big piece of what we were able to do, is get the rest of the campus and our assistants from our Office of Institutional Research and others on campus to really understand, like, what's happening with our students now in terms of their behavior and what do we want to have happen. Keep going, next slide. And so here's all of that, how that fits, right? If you think about those 3 areas, this is how all of the things Jim just talked about kind of fit, and they all do kind of come back to the course as the central theme of the program. Keep going. Next slide. The 4 pillars Jim talked about. Next slide. And then just a hint toward the outcomes, and I'm going to leave a teaser here for the Legal Issues Conference. I'm not going to go into all of the outcomes and the data that we have, but here's just a list of what we did track over these years with the wellness environment in place. Next slide. Which is looking at our high-risk drinking. So was it changing students' behavior? Was it any different than anybody else on campus? Looking at our conduct incidents by percentage of the students in this program across the rest of the campus. Looking at damage, since we know alcohol and high-risk drinking often leads to damage and other secondhand effects that are negative in a student experience. First-time, first-year retention. Does it help students stay? Do they do better in their GPAs? Does it even matter that they're a part of this program when you think about it? And then, again, the very unintended but really wonderful outcome that President Sullivan mentioned is the university's reputation. Next slide. And we found ourselves kind of in the middle of a firestorm of folks really wanting to know what this medium-sized campus in the Northeast was doing, changing so many of the measurements that other colleges face around their drug and alcohol use, and what we know can really be a distraction from why students are in college and what they need to be getting out of college, and how we can help them be their best selves. So with that, I leave it to you, and we can go to questions and answers.
Thank you, Annie. Thank you, Tom. Thank you, Jim, for sharing the insight and the path to the success of the wellness environment, the WE program, as we call it here at UVM. I'm going to start with a question first for Tom, and then maybe Jim, I'm going to have you on deck, and Annie too. I'd love your input on this. I think about potentially some of our viewers and just other college campuses. This is not a unique problem on college campuses that Tom identified, but is it unique enough to UVM, what you've created? Because I think about what Annie was talking about with Jim's involvement and his vision and that drive. Is this repeatable? Is this something that another college campus can say, how do I do that? And granted, we've talked about all of those pieces, and Annie kind of even laid out the financial and staffing. How could another university envision themselves taking this program and trying to take the science mixed in with the residential and the coursework and the curriculum and to move it onto their campus? Because this shouldn't just be ours, right? Shouldn't we be trying to bring this to students all over the United States? And Tom, I'll start with you on that.
I'm happy to try to address that, and I know Jim can do this as well, particularly. I think it takes at least 3 critical pieces. Leadership from the top, as I mentioned earlier, and it was very important to us to name the problem, identify goals, and work out the implementations. And Jim and Annie and I and the team, we met very, very often early on and straight through the time I was in the president's office. And I wanted to stay on top of all of the developments to the extent I could, because I wanted to be able to be the ambassador for these ideas and this implementation that Annie and Jim were doing, because it was so important to the learning environment. That's what it was all about. It was not about avoiding litigation. We didn't even think about that, even though I'm a lawyer. It was about helping our students understand healthy minds and bodies and what it would do for their own maturity. So it starts with the top. You have to have a brilliant scientist and researcher and fabulous teacher like Jim to actually put the science and the medicine together in such a persuasive way that he does every day. And of course, Annie, 30 years in now, with all of her great experience and wonderful colleagues, they took the vision and really implemented. But it took all levels of the university and the community, and I think our commission, Annie and Jim, helped as well. We had faculty, staff, students, parents, alums on this, giving us advice that really helped us understand the problems at home, quite frankly. Jim mentioned when you go home and how different it is from the campus environment. So I really think it takes a full integrated effort from the top to deep, serious science and to great professionals like Annie that know how to implement these things. And it's all about, as Annie said, it's about the learning environment. It's about the health and wellness environment of the students. The goals were all about students, and we tried not to lose that fact throughout these years, I think. And the data speak for themselves on the success of the story. But you have to keep after it, and those two did every single day.
Thank you, Tom. Jim, I'd love to hear from you. How do we help other students? Because I imagine that's underlying passion of yours, is how do we help more students on college campuses to see that this is a possibility?
There's no question. It's my primary passion is to, as a research scientist and physician, it's not just to sort of create, test, and implement, it's to disseminate. And I was honored to be at a meeting in Georgetown by the Mary Christie Foundation, which 100 presidents and provosts attended. And my strong first message, this was I think the third convening, but Tom actually was at the first one. My first message was, don't even attempt this if you can't get the ear of the president and the provost. And institutional behavior change has to precede or at least walk hand in hand with implementing behavior change at the residential life and student life. So this has become a very clear vision quest for me, and I'm working really hard with one of our wonderful deans, Cynthia Bellevue, and the team here to debunk and demystify that there's nothing Jim about this. This is common sense. I'm creating with that team something called the We Educational Institute that starts with exporting the curriculum. You can't shake a dead cat above your head and not hit a world-class neuroscientist on any campus in this country right now. So the scientists are there. If we can get leadership to be there, we can export curriculums. We can teach you how to build these pillar-based, incentivized-based behavior change programs. So we're right in the midst of that, working very, very hard to making sure that we can, and actually in November, share with a group of enlightened universities who want to join us in sort of a wellness coalition, start to investigate how we metastasize this lesion. I would add, by the way, it's not easy. This didn't go exactly the way I wanted. And that means that there were times when our president said no. And there were times when Annie said, I don't think so. And the strength of this idea is that you work in this iterative environment where people respect each other. And you say, okay, the boss said no, I got to go try it this way, or I got to go try it that way. And that's something we're going to try to deliver at this educational institute. We're going to ask Tom to come back and specifically say, what were the times you told him no? and why. And Annie come by and talk about, what were your highs and lows, because that's critical. We need the residential life team. We need the student health team. We need the vice provost of student affairs. We need the provost there. Dave Rozovsky did a wonderful job of modifying his provost role. And now Patty Prelock has just been transcendent in helping sustain this model. So in answer to your question in a long-winded way, Nicole, it's so important to me that we're working really hard on developing a way to disseminate this to other universities.
Thank you, Jim. I had a feeling. So I do want to toss over to Annie as well, because you so thoughtfully laid out some of the pieces that it took here at UVM. If someone called you up tomorrow and said, Annie, I've got to do it, help me do it here, what advice would you give to them?
Yeah, hang on tight, and be ready to constantly remind the student affairs staff what the priorities are, because funding might have to shift toward a certain program that you're trying to pull off. I liked that we started as a pilot. I liked that we assessed along the way and saw what could we change. And also, I should be upfront that this wasn't the only initiative we were taking on to reduce our high-risk drinking at the time. But if you stay with us during the Legal Issues Conference, I can show you the time and the moment in time where the wellness environment began. We saw significant drops. We had seen early drops with other initiatives because of the coalition that President Sullivan set up. We saw some very big early wins, but then the wellness program came around, and that's when we started to see even bigger wins in terms of what we were assessing and our outcomes. And because the numbers were with us, that this is something that should be on every college campus. Matter of fact, it should be how we do the student experience on every college campus, and get away from this notion that is a myth out there around censoring alcohol and drugs in college. So I think it's making sure the priorities are known, making sure that the funding follows the priorities, and that you're going to have to do some things differently along the way. And that doesn't feel good all the time to folks who know the cycle and the cyclical nature of higher ed and get into that, and of programs or health services or how we support students, and to interrupt some of those natural cycles of our work can feel hard, and it's change management at its best.
Annie, thank you so much. And Jim and Tom, thank you so much for all of your insight. And the most exciting thing I think about this conversation is it's not the end. And I just wanted to toss over to a slide. It is a promotion. I was going to say it's a little bit of, but it's a lot of promotion for the Legal Issues in Higher Education Conference, which is starting in just less than 2 weeks, because this conversation continues with Annie, Dr. Hudziak, and Tom Sullivan, because this information is so important, and they will be diving in deeper into this topic. The session that they'll be doing is called Creating a Wellness Environment, which we call it here, to promote health and reduce risk. So continuation of this conversation, we highly recommend that you please join the Legal Issues in Higher Education, because that's just one piece. The insight from these panelists is just one of the pieces that'll be happening here in another 2 weeks. And so we have information up on the slide as well for the Legal Issues Conference. We're about 2 minutes away. So I just wanted to give each of you an opportunity. Now I'll start with Tom, and then we'll go to Jim, and then we'll finish with Annie. 5 or 6 years out from the vision of this, and I know there was so much work, what is maybe one thing that you're most proud of at this point? And Tom, let's start with you.
Well, I would just pick up on the last point and question that was made by Annie and implicitly by Jim as well. This can't get launched, and it can't be implemented, and it can't be successful unless it's an integrated team sharing the same vision and the same goals. If you have people who don't want change, or people who can't work together in harmony, and with a very specific strategic goal and objective, it simply won't work on a campus. You've got to have all the buy-in in an integrated way, and it starts at the top with talented people all the way through the university. That's what a community, that's what a healthy university community should be, and I think that's what we have here at the University of Vermont.
Jim, we'd love to hear from you as well.
Yeah, I'm just grateful for the students. It's been incredible. They've given me a lot more than I gave them, so I would share that.
Thank you. Annie?
I agree particularly with Jim about it's the student experience to me every day, every time, and to see our students thriving, not just surviving a college campus, but thriving in a college campus and being excited about being in college and doing it in a healthy way. It can't help but inspire the best of us. So that's why I'm a part of it.
Great. Thank you so much, Annie. Thank you, Jim. Thank you, Tom, for taking time out of what I know are incredibly busy schedules. And thank you again also for joining our Legal Issues in Higher Education Conference, which is coming up. So you're not off the hook yet, the three of you. We've got more work to do with you. And thank you everyone who has joined us on YouTube today. We are at time, so we're going to say good afternoon, and we look forward to seeing you at the Legal Issues Conference in another week and a half. Have a great afternoon.
Thank you.